Hey friends, welcome back to today's episode. Today we are going to talk about something that is simple but really powerful, and that is getting your annual checkup. Now, before you hit skip on this episode, I want us to slow down for a minute and talk about what an annual checkup is, what an annual checkup is not, what you should expect at your annual checkup, and I want to take a little bit of time to talk about common reasons that women skip their checkup and kind of how we can reframe those thoughts to make sure that we get it done. Are you a busy woman who prioritizes everyone else's health above your own? Do you have questions about your diet, exercise, or how to prevent or treat certain health conditions? Are you always Googling health questions that you forget to ask or are embarrassed to ask your primary care physician? Girl, do you even have a primary care physician? Well, welcome to Headed to Healthier. I'm Dr. Brittany Anderson, a board-certified family medicine physician, and every day in my private practice, I have discussions with women just like you who are doing their best to juggle the demands of life while also desiring to become healthier. Inside this podcast, you'll find practical and actionable health tips that you can incorporate into your daily life. You'll get expert advice and insight from some of my awesome healthcare colleagues, and you'll hear relatable conversations with incredible women just like you who have made their health a priority and are thriving because of it. So throw on your sneakers and get some steps in while you listen. Or if you're driving, get those hands at 10 and 2 and let's dig in. We are headed to healthier. Getting your annual checkup done is really about reclaiming your health story, one intentional visit at a time. So if it's been a while since you've had a checkup or if you've been putting it off, this episode is especially for you. Let's think about kids. So kids get checkups at various ages. They usually get one a couple weeks after they're born, so like a 2-week checkup. They get a checkup usually at 1 month, then again at 2 months old, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, and then they start getting yearly checkups. So 2 years old, 3 years old, 4 years old, and so forth. So I'm a family medicine doc. I see kids for these regular checkups. I encourage their parents to make sure they're bringing them in, that they're not missing these appointments. But also as a family doc, I really encourage my adult patients to get these checkups done as well. Just like they're important for kids to make sure, and kids we're checking to make sure that they are hitting their developmental milestones and that their intake is good and that they've got normal output, that they are sleeping okay, that their mental health is good. The same thing we should be checking in adults. And so if you have missed your annual checkup or if you just not had an annual checkup in several years, we're going to talk about it today. So let's start with the basics and just talking about what an annual checkup is. So another name for an annual checkup, some folks may call it, is a wellness visit. For some people, if you have insurance through your employer, they will ask you to get it done and even will give you like a percentage of discount on your annual premium. So at this time of year especially, I have a lot of teachers coming in, a lot of people who work at plants saying that they need to get their preventive visit done to lower their insurance premium. So it really is a preventive appointment that you schedule with your primary care provider. So that is you're scheduling it either with your family medicine doctor or if your primary care provider is an internal medicine doctor. Now, I want to be clear that your annual checkup is different from a sick visit, and it's really different from like a chronic follow-up visit. So think about what happens when you go in for a sick visit. So generally you're calling on the day of, hey, I've got a sore throat, runny nose, headache, I've, stubbed my toe, whatever. You go in and the doctor that you see is generally looking just at that thing that you said you came in for. So there's some patients who have, 4 or 5 visits a year, but none of those are actual checkups. Those are visits that are sick visits. They're visits because you got the flu or you've got strep throat or you've got back pain or knee pain. And it may be that at these times you're not getting a full physical exam. Maybe you're getting what we learn in medical school as a focused exam, where they are looking at just that thing, that part of the body that you come in with. That often happens, and there's nothing to say that that's not right. They are doing what you came into that sick visit for. We also have visits where people come in for just their chronic follow-up. So an example of that is someone who has diabetes and they are coming back for their 3-month follow-up to get their A1C checked again, to get their medicines refilled, etc. Yes, that's a time that we could handle some of the things we generally talk about at that annual physical exam or that annual checkup or wellness visit. But really, in my head, an annual wellness visit or your annual checkup is different. It's a time for us to do a couple things to review your vital signs. So, like looking at your blood pressure, your weight, your heart rate. It's a chance to go over lab work. So, one, to get lab work done, but also to go over lab work. So, like cholesterol and blood sugar levels and thyroid levels. And what I love for my patients to do when we're doing that annual checkup, and really for any visit if we can, is to come in before that visit and get their labs done so that when I see them for their appointment, I've got their labs right in front of me and we can talk about them face to face. The alternative is if we get them done when they come in for the visit, that I or my nurse are calling them back after the visit, and then there's the back and forth on the phone about your lab shows this, what do we want to do about it? So I really like the idea of having patients get those labs done first, and then when we're there at the visit, we're able to talk to them. So the annual checkup is a really good time to be able to go over lab work. It also is a time to talk about screening, and that I think is really the key point of annual exams. And so, insurance companies generally will pay for an annual exam, what we call a preventive exam, and there's a reason that they do this. So, insurance companies, as we all know, are really all about their bottom line, and they will pay for these visits, or these visits will be a part of your coverage with them. Generally, you don't pay a copay, it doesn't go towards your deductible or anything like that. And sometimes I'll hear patients at the front who are checking in for their annual checkup visit and they're surprised that they don't have a copay. And so, my receptionist is like, no, there's no copay for this visit. This is just your annual checkup or your, wellness visit or preventive appointment. And that's covered by your insurance company. Well, the insurance company is not just looking out for you and wanting you to save a few dollars of not having to pay a copay, but they're looking out for themselves too and their bottom line because they realize that at these annual visits, if we are able to screen for things like breast cancer and cervical cancer and colon cancer and osteoporosis, that we are saving them money by finding these things early or preventing these things. And so if we are getting our regular breast cancer screening set up, we're getting that mammogram set up at this appointment, we're getting our pap smears done at these appointments, we're getting patients set up either to have their colonoscopy done or to have a Cologuard done, then insurance companies are saving money down the road because we're being preventive. We're helping prevent these patients from getting these cancers that are certainly going to be really expensive to the insurance companies. And so I want you to take advantage of this. If your insurance company is willing to say, all right, we will let you have this visit at no additional cost to you, you don't have to pay a copay, it doesn't count towards your deductible, then by all means, go get that visit done. The annual checkup is also a really good time for us just to talk about what's going on with you. So I make a point at this visit to talk to my patients about their intake. So, what their diet is like, making sure they're eating healthy foods. We talk about their output, what their urine habits are like, what their bowel movements are like. We talk about their sleep habits. We talk about stress. We talk about what kind of physical activity they're getting done and so much more. And I stress to my patients at these annual checkups, but at all of their appointments, that it also really is a time for patients to ask questions. So just as much as we want to catch things early, we want to make sure that patients are able to ask questions that they may have then. And really what I also like to do at this visit is to set goals. And so I'll say something like, this is our annual checkup. We're going to see you next year, hopefully around the same time. What do you want to have happened with your health between now and then? And patients may say things like, well, I want to be able to come down on my diabetes medicine, or I want to have lost 20 pounds by then. And so that gives us a time to set smart goals and to start thinking about what actions the patient can take to actually reach those goals. So that's generally what we do at an annual checkup. Now, as we age, and certainly as we get into our 30s and 40s and 50s, this is a turning point in our lives, especially as women. And one thing I tell folks is that you may feel fine now, but age sometimes will catch up to us a little bit. When we get into our 40s and certainly into our 50s, we see numbers start to change. We see our blood pressure may generally start to shift, especially as we go into perimenopause or menopause, because we're getting those hormone changes and shifts in our estrogen level. We do start to see changes in our cholesterol. Our cancer risk increases as we age, which is why it's so important to get those screenings done that we talked about earlier. and we start to have weight shifts as well. And a lot of those things, like the blood pressure going up and the cholesterol going up, those are things that are often silent. And so patients may not feel anything. And so that's why early detection or getting these preventive visits is important. Annual visits really help us to catch trends and to catch changes before they become problems. So I'll highlight that with an example of a patient came in just because it'd been a while since she'd been seen it anywhere. It'd actually been years, but she thought, all right, it's time for me now to, get a primary care provider and just get an annual checkup done. I was really pleased that she came in. She had nothing going on. She was like, I'm not sick at all. I don't take any medicines. I don't have any new pains or aches or anything like that. I'm just here for a checkup. And then when people say that, my eyes light up because a checkup I can do. We made sure we got good vital signs on this patient. We made sure we got labs done. We talked about kind of what her health goals were. And then we made sure that we had her set up for the appropriate screening that she needed for her age. And so with this patient specifically, we got the labs done. Her labs actually showed some pre-diabetes, and her lipid panel, which is what looks at our cholesterol levels, showed that she had high total cholesterol. And so those are things that she had no idea about before she came in. But because we caught it early, while we were still in the pre-diabetes stage, and while there was still time for her to be able to really make some lifestyle changes, she made those changes. And I've already seen her back since then, and she has completely reversed the pre-diabetes, and the cholesterol numbers are coming down. And so imagine in that same person that she'd waited, said, hey, I feel fine. I don't have any issues going on. I'll still just go in if my knee hurts or if I have a headache or something like that, and I'll let the doc tend to those things. But she had the wherewithal to say, I need a checkup. I need an annual checkup, annual physical exam. Came in, got those labs done. We were able to find this early. I did an earlier episode that talked about hypertension and how, again, hypertension generally doesn't come with symptoms. And I worry when patients have really high blood pressures and they don't have any symptoms at all. That's why, honestly, we call hypertension a silent killer, because it can get super high. Your body can kind of adjust to it being high. Even if you feel okay, we can find those things there, even more so with the lab. So, you can be going in for an acute visit or for a sick visit, and you'll get your vital signs done. So, sure, we can catch the high blood pressure earlier on. But the things that come with drawing labs and getting a good physical exam done of your full body, those are things that we generally catch on these annual visits. And that's the hallmark of prevention. There's a saying in medicine that an ounce of prevention is worth a pound of cure. And this really gets to that point. It's so important to make sure that we are preventing things and we're being proactive instead of being backed into a corner where we've got to be reactive once we have a diagnosis. So let's talk about what happens at your checkup. And I've already started to talk about a little bit what you can expect at that appointment. But generally, you come in, you get your vital signs done. So those vital signs are going to take a look again at your blood pressure, at your heart rate. It's going to check your temperature, going to check weight and height so that we can calculate a BMI from that as well. And then when you're in the room talking with the doc, a couple things may happen. For sure, generally, if they haven't done it already, they're going to talk to you about your personal history, especially if anything has changed since the last time you saw them there. So I really like to get kind of an interval history. So, if I'm seeing you this month in July, what has changed since the last time I saw you in July? And patients may say various things. They may tell me more social things. My daughter's gotten married. I got divorced from my husband. They may say more clinical things like I saw my cardiologist and she changed this medication, or I've had a knee replacement since the last time I saw you. And so I think it's important to know just kind of what's been going on. And I like both the clinical update and the social update. Again, I'm a family medicine doc. I like to look at the person as a whole, not just focusing on one specific part of their body. There also likely will be discussions about kind of your mood and where you are as far as a mental space. In my clinic, we do a little questionnaire for patients. So they come in, they fill out this questionnaire, and it helps us to make sure that there's no depression that I may have missed before, or that they didn't come in planning to talk to us about. And so they fill out this little questionnaire so that we make sure that we're not missing anything along those lines related to their mood. We also talk about what their sleep habits are like. We talk about alcohol use and tobacco use. And then we get into a physical exam. And so at this annual checkup, I like to do a full physical exam. And so, we're checking ears, we're looking in the back of the mouth, we're checking to see how the thyroid feels, we're listening to heart and lungs. We are getting a good abdominal exam. I'm checking range of motions and making sure those joints are doing okay, making sure there's not any abnormal swelling. I'm getting a good skin exam. I may be doing a breast exam as I'm getting a woman set up for a mammogram. I may also be doing a pap smear if she's due for a pap smear at that visit as well. And so getting a full visit done then, getting a full exam done then, and then also looking at labs. So generally once a year after we get to a certain age, we ought to be getting our blood counts checked. We ought to be getting thyroid levels checked. Our cholesterol should be being checked. Our sugar levels, our kidney function, liver function. So again, I take this as a good opportunity for us to get those labs done that are needed and to get any orders placed that are needed for screening. So I mentioned the pap smear. So either if I'm doing the pap smear there that day or getting them set up to come back for a pap smear later, if they are of age that they need a mammogram done, then I'm getting the order put in for the mammogram. If they need colon screening done, I'm either putting in an order for a colonoscopy or we're getting a Cologuard ordered for them. And if they are at age that they are at risk for osteoporosis and need to get what we call a DEXA scan done, then I'm ordering that too. And like we talked about, also then just really taking a chance to talk about anything that may be on the patient's mind. And so many times this is where those discussions that we talked about in a recent episode with Dr. Lodi that I'll tag on this, but where the discussions about perimenopausal symptoms really start to come up as well. And I welcome those discussions. I think if this is your once a year time to come in, we're not, really talking about, I have this going on, I have a cold this week or my knee hurts. It's a time for us to talk about kind of where you are as a person, what you feel like, how you're doing emotionally, where you are. And you're allowed to bring notes. In one of my very first episodes, I talked about how to prepare for your doctor's appointment. And one of those things that I said was to jot down the questions that you have. And you're allowed to bring notes. You're allowed to take notes during that visit. I think those things are really important. I want you to keep in mind that this annual checkup, this preventive exam, is for you. And so you ought to leave there feeling like if this is the only time you go to the doctor in a year, which it doesn't have to be, but if this is the only time you go in a year, you feel good about the exam that you've gotten done, you feel good about the labs that were ordered and the screening that was set up for you, and that you leave there with a plan of what you can do to reach your best health over the next year until you see them again. And of course, if anything comes up in the meantime, you know that you have developed a good enough relationship with that physician in that office that you can call them before, 365 days later and get back in with them to talk about those things. So I've shared with you the reasons that we should get an annual checkup done. I've talked to you about the things that are going to be done at that annual checkup usually, but so many women still skip their checkup. I can't tell you how many times I'll go and look back through a patient's chart and the last 6 or 7 visits that I've seen them in clinic for have all been sick visits. It's been, a cold this time, knee pain this time, a skin and rash this time, ingrown toenail this time, and we've just not gotten a true checkup done, a true full physical exam done. And let's be honest, most women I talk to know that the checkup is important, but they still don't go. So I wanted to share kind of the top 3 reasons that I hear from women about why they don't get their checkups done and how I encourage them to rethink these things that they may tell me. The number one reason, hands down, number one reason that I get back from women is, Doc, I feel fine. Well, like we talked about earlier, especially with blood pressure and prediabetes and cholesterol, that you can feel fine and still have something silently brewing. So prevention, again, it should not be about reacting. It should be staying ahead of the game. So the most common excuse that I hear is I feel fine. The second most common is probably right up there with I feel fine is I don't have time. My whole purpose for doing this podcast is really to create a way to reach out to women who have poured so much of their lives into other people, whether it's taking care of your children, taking care of your parents, being super active at work or church, or whatever else you've got going on. But that women who have decided, all right, I've got to make a change. I've spent all this time taking care of other people. I have to take care of myself. What I so often hear folks say is, I have this, and this going on. I don't have time to go in and make a checkup. I feel fine. Like I said before, there's nothing going on with me. I don't have time for this visit. Let me stress to you, if you take nothing else from this talk, let me stress that a 30-minute appointment, an hour at the most, can literally add years to your life and may literally save your life. You make time for everyone else. This is my reminder to you to please make time for you. I want somebody, and someone listening to this can be in charge of this later, but literally on my headstone, I wanted to say, Brittany Anderson, my date of birth, date of death, and under it, it needs to say, go get your checkup done. That is how important this is to me. So number one excuse that I get is, doc, I feel fine. Number two is, I don't have time for this. And I encourage you that if that is an excuse that you like to use, the not having time, go back and listen to last week's episode. It was a wonderful episode with the guest Melissa Batt, who is a life coach, and she really talked about where we're losing time and how we can use that time once we find it from doing a time audit, and we can really go back and find ways to take that time instead and do it to things that are best for our health. So listen to that if you haven't. But the third thing that I hear from women, and I hear this one so often, is, I'm scared of what they'll find. And I get it, but avoiding the checkup does not prevent the problem. And so I tell my patients, I understand that sometimes it is, stressful to you to think that I may get a bad result or we may have a bad outcome from this. But the only thing in my head worse than having a bad result is having something going on and you have no idea. Now, you may be different. You may be someone who says, Dr. Anderson, I'd rather not know at all. But from a physician standpoint, from my standpoint, I can't do anything about something that I don't know anything about. And I can guarantee you, with most diseases, just the way diseases progress, that even if you're not having any symptoms and you feel fine not knowing because you don't have any symptoms, most diseases usually progress to you having symptoms. And all not knowing does is delay the chance for being able to fix it. And so having detection early is always going to be easier. And often if we can get some type of treatment on earlier, then that treatment may not be as bad as the worst thing that you're thinking about if we let diseases progress. And so I encourage you, this is your action step from this episode. If you have not already had your annual checkup this year, when you get finished listening to this episode, I want you to pull up your phone and I want you to call your primary care doctor and schedule your annual checkup. Now, again, I don't mean if you went in 3 months ago and got a shot in your knee for your knee pain, that kind of thing. I mean, if you have not had a designated annual checkup, again, most insurances will cover the costs for this. Pull out your phone, call and schedule it. And when you do, put it on your calendar and make sure that you keep that appointment. It is too easy, I know this from my own experience, to make an appointment and then when they call you for the reminder to say, hey, don't forget you've got this appointment tomorrow, to say, you know what, I'm going to cancel it and I'll call and reschedule it later. I beg you not to do that. If you make this annual checkup, keep it. Making and keeping this appointment is one of the simplest but most powerful ways for you to really invest in your long-term health. And if we can look ahead, when you leave that appointment, so once you've gotten it done, go ahead and schedule your appointment for the next year. And you can tell them, if you go in to get that appointment done on July 17th, say, hey, go ahead and put me on the schedule for July 17th next year. You may also decide, all right, I'm not going to get it scheduled for just a random day. I'm going to get it scheduled on the Monday after my birthday every year for the rest of my life, or some time that you can remember. So even if for some reason you don't get it scheduled, when that time starts to roll around, you think, hey, I'm supposed to be doing something on this day, and then boom, there's your reminder to get it done. So that's it for today's episode. If this was the nudge that you needed, good. That was my goal. If you've already gotten your annual checkup done, but you listened to this whole episode anyways, I appreciate you. Thank you so much. And do me the favor of sharing it with someone else that you think may find it helpful. And if you've not done so already, don't forget to subscribe to the podcast so that you never miss an episode. I've got some really great episodes planned coming up. I've got some great guests who are going to come share with us in the next few weeks. And I really look forward to every week breaking down something that really matters to you, that matters for your health. I want us to have just real talk, no guilt trips, no overwhelm, just a chance for us to all get headed to healthier together. Hey, thanks for listening in today. I hope something you heard in this episode will help you on your journey to becoming healthier. Remember, this podcast offers general health information. I am not your personal physician. If you need advice that is specific to you, be sure to consult your physician. If you enjoy this podcast, please consider sharing it with a friend and reviewing it on Apple Podcasts. Also, be sure to subscribe to the show so you never miss an episode. Tune in next week for another great episode of Headed to Healthier. Until then, take care of yourself. Talk soon. Bye.